Welcome to channel. In this video we will talk about Spain and other countries. The pandemic was confirmed to have spread to Spain on the 31st of January 2020, when a German tourist tested positive for SARS-CoV-2 in La Gomera, Canary Islands. By the 24th of February, Spain confirmed multiple cases related to the Italian cluster, originating from a medical doctor from Lombardy, Italy, who was on holiday in Tenerife. Other cases involving individuals who visited Italy were also discovered in Peninsular Spain. By the 13th of March, cases had been registered in all 50 provinces of the country. A state of alarm and national lockdown was imposed on the 14th of March. On the 29th of March it was announced that, beginning the following day, all non-essential workers were to stay home for the next 14 days. By late March, the Community of Madrid has recorded the most cases and deaths in the country. Medical professionals and those who live in retirement homes have experienced especially high infection rates. On the 25th of March 2020, the death toll in Spain surpassed that reported in mainland China, and only Italy had a higher death toll globally. On 2nd of April, 950 people died of the virus in a 24-hour period, at the time, the most by any country in a single day. The next day Spain surpassed Italy in total cases and is now second only to the United States. As of the 16th of April 2020, there have been 188,068 confirmed cases with 72,963 recoveries and 19,478 deaths in Spain. The actual number of cases, however, is likely to be much higher, as many people with only mild or no symptoms are unlikely to have been tested. The number of deceased is also believed to be an underestimate due to lack of testing and reporting, perhaps by as much as 10,000 according to excess mortality analysis. Now we will talk about United Kingdom. The United Kingdom's response to the virus first emerged as one of the most relaxed of the affected countries, and until the 18th of March 2020, the British government did not impose any form of social distancing or mass quarantine measures on its citizens. As a result, the government received criticism for the perceived lack of pace and intensity in its response to concerns faced by the public. On the 16th of March, Prime Minister Boris Johnson made an announcement advising against all non-essential travel and social contact, suggesting people work from home where possible and avoid venues such as pubs, restaurants, and theaters. On the 20th of March, the government announced that all leisure establishments such as pubs and gyms were to close as soon as possible, and promised to pay up to 80% of workers' wages to a limit of £2,500 per month to prevent unemployment in the crisis. On the 23rd of March, the Prime Minister announced tougher social distancing measures, banning gatherings of more than 2 people and restricting travel and outdoor activity to that deemed strictly necessary. Unlike previous measures, these restrictions were enforceable by police through the issuing of fines and the dispersal of gatherings. Most businesses were ordered to close, with exceptions for businesses deemed essential, including supermarkets, pharmacies, banks, hardware shops, petrol stations, and garages. Now we will talk about North America. The first cases in North America were reported in the United States in January 2020. Cases were reported in all North American countries after St. Kitts and Nevis confirmed a case on the 25th of March, and in all North American territories after Bonaire confirmed a case on the 16th of April. On the 20th of January, the first known case of COVID-19 was confirmed in the Pacific Northwest state of Washington in a man who had returned from Wuhan on 15 January. The White House Coronavirus Task Force was established on the 29th of January. On the 31st of January, the Trump administration declared a public health emergency, 682, and placed restrictions on entry for travelers from China. President Trump signs the Coronavirus Preparedness and Response Supplemental Appropriations Act into law on the 6th of March 2020. On the 28th of January 2020, the Center for Disease Control, the leading public health institute of the U.S. government, announced they had developed their own testing kit. Despite doing so, the United States had a slow start in testing, which obscured the true extent of the outbreak at the time. Testing was marred by defective test kits produced by the federal government in February, a lack of federal government approval for non-government test kits by academia, companies and hospitals until the end of February, and restrictive criteria for people to qualify for a test until early March. A doctor's order was required thereafter. By the 27th of February, the Washington Post reported fewer than 4,000 tests had been conducted in the United States. By the 13th of March, The Atlantic reported that fewer than 14,000 tests had been conducted. On the 22nd of March, the Associated Press reported, many people who have symptoms and a doctor's order have waited hours or days for a test. After the first death in the United States was reported in Washington state on the 29th of February, Governor Jay Inslee declared a state of emergency, 690, an action soon followed by other states. Schools in the Seattle area cancelled classes on the 3rd of March, 693, and by mid-March, schools across the country were shutting down. On the 6th of March 2020, the United States was advised of projections for the impact of the new coronavirus on the country by a group of epidemiologists at Imperial College London. On the same date, President Trump signed the Coronavirus Preparedness and Response Supplemental Appropriations Act, which provided $8.3 billion in emergency funding for federal agencies to respond to the outbreak. Corporations imposed employee travel restrictions, cancelled conferences, and encouraged employees to work from home. Sports events and seasons were cancelled. On the 11th of March, Trump announced travel restrictions for most of Europe, excluding the United Kingdom, for 30 days, effective the 13th of March. The following day, he expanded the restrictions to include the United Kingdom and Ireland. On the 13th of March, he declared a national emergency, which made federal funds available to respond to the crisis. Beginning on the 15th of March, many businesses closed or reduced hours throughout the U.S. to try to reduce the spread of the virus. By the 17th of March, the epidemic had been confirmed in all 50 states and in the District of Columbia.
Press the bell icon on the YouTube app and never miss another update.